Despite available interventions to prevent mother-to-child transmission of HIV, a sizable number of babies are accounting for new infections. According to the Chairperson of the Uganda AIDS Commission, Dr. Ruth Senyonyi, in 2024, 4,700 babies were infected with HIV through mother-to-child transmission. She was addressing journalists in preparation for the International Candlelight Memorial Day due to be commemorated in May. Despite the decline, mother-to-child transmission of HIV contributes 13% of all HIV new infections.
Because having 4,700 babies born with HIV in 2024 is a big number, and therefore we need to reduce that number to almost zero if we are to end AIDS by 2030. Therefore, we want to encourage pregnant women to go for HIV testing, and if found positive, they should be started on treatment and put on the ART treatment as per treatment guidelines.
According to UNAIDS, Uganda needs to sustain efforts directed towards the fight against HIV in order to achieve the global goal of ending AIDS by 2030.
We must also strengthen community-led responses by committing to the global strategy targets and ensure that communities lead at least 30% of services, they deliver 80% of programs, and that 60% of available funding is directed at the grassroots level.
Another area of concern is how women and girls can have access to HIV prevention options and financial empowerment to reduce transactional relationships.
They also need to be given accurate information to make informed choice, because while now LAN is the hot cake, but there are also other prevention options like the prevent vaginal ring, there is the cabotegravir, there is the oral PrEP. All these are options. There is condoms. All these are options. So women must be availed with information on all these options so that they are able to make informed decisions.
Community level is where the fight starts. So if we are to have 30, 80, 60, the community-led, community-based, and financing directed towards the communities, it means we have to go down to the communities and get them the accurate information. So how are we doing this for Candlelight? We're going to 9 cities around the country. That's Jinja, Mbale, Soroti, Gulu, Arua, Fort Portal, Hoima, Mbarara, and Masaka. And we're going to the marketplaces. In the markets, we find that there are quite a number of women there who are working and don't have time to go to the health centers for services. So why don't we take the services to them where they are?
And we cannot underestimate how much power comes with education. Power to negotiate, in case she's in a relationship, her negotiation skill is better. Power to know that when I go to school, I will make money and I will have my own money as a woman, as a girl. I will not depend on a man. I will not engage in transactional sex because I have power. Power is very powerful to a woman, to a young girl.
Uganda AIDS Commission 2024 statistics show that there are 37,000 new HIV infections. Adia Nakute, UBC.